Hi, I'm Dr. Lee Roberts with LAR Physical Therapy in Columbia, Maryland. I'm here to talk to you today about stretching. Most of you are probably familiar with static stretching. Stretching where you hold a position for about 30 seconds, allowing the muscle time to relax and lengthen. That's a great type of stretching and it's very effective when done properly and often. The other kind of stretching that I like to teach to my patients is called active stretching. Maybe you've heard of this. If you haven't, we're going to teach you today how to do it. Some of the benefits of active stretching are that it can be performed when you're not warmed up. It's going to utilize the neural pathway of reciprocal inhibition to relax the muscle so that you are stretching a relaxed muscle. We're going to move through range of motion, and that's going to also help with neuromuscular re-education into correct movement patterns. The stretches are generally held for 3 seconds and repeated approximately 10 times. Hi, I'm here with Dr. Jen Pellig. We are going to show you how to do an active stretch for your hip flexors. The hip flexors are those muscles in the front of your hips up here. We're going to have Jen come into a half kneeling position, which means one leg is forward, one leg is down. Make sure that your front knee is over your ankle so you have a nice wide base of support. And the back foot can either have toes down to the mat or toes curled under, whichever place you feel more stable. It is nice to do this near a sofa or a piece of furniture or even a ball or something if you need extra balance. The active stretch for the hip flexor is going to use the glutes to contract to stretch the front of the hip. So you're going to tuck the tailbone under, lengthening the front of the hip, and release. We're going to hold that for 3 counts, just like we've done with all of our active stretches. You want to repeat it at least 10 times on each side for a total of 30 seconds stretching. What's so important about this stretch is that you really are rotating in the pelvis and not just shifting your weight forward to get the stretch. If you're just shifting your weight forward, that is not correct. It really is about rotating the pelvis. If you want to increase the stretch, you can add both arms reaching up to the ceiling, holding for 3 counts, and bringing them down. That should add a little bit of increase to your stretch. I love doing this active hip flexor stretch. Of course, if you need more cushion under your knee, feel free to put a pillow there. This is active hip flexor stretching. Feel free to check out our other YouTube videos and the website